It's that time of year, though, when people often get sick, even here in the sun. So in today's HealthCast, Local 10 health specialist Christy Kruger takes a look at why you should be so careful before you consider taking antibiotics.
Jessica Oral loves to run, both for its physical and its mental benefits.
It helps clear your mind, sometimes stress, all that stuff, the daily stuff gets in your head, so it kind of helps clear your brain.
She had to take a break last summer when she got sick. After several days on antibiotics, she felt good enough to go back to the gym. A few minutes into her workout, her knee began to hurt, and the pain only got worse.
And I couldn't walk that well, and I started noticing that I couldn't lift my leg.
Turns out Jessica had partially ruptured a tendon. That's a risk that happens with a class of antibiotics called fluoroquinolones.
I've diagnosed about 12 partial tendon tears while doing strenuous exercise on these antibiotics.
Physical therapist Bruce Wilkes says any kind of strenuous exercise can increase the risk, and many athletes do start working out just as soon as they start to feel better.
There is not good data on when it's safe to do strenuous exercise after the antibiotics. 24 hours is a good place to begin.
While there is an FDA black box warning about the risk of tendon ruptures while taking fluoroquinolones, there was no notification on Jessica's prescription bottle. That means patients have to be proactive.
Ask questions. If you're an athlete, ask your doctor, is it safe to do athletics?
I would never say don't take a medication. That's totally up to the person, but at least know what you're taking. That's my thing. If I would have known that, I would have told them, don't give me that, give me something else, even if I have to be sick longer.
Now, steroid use while on these antibiotics also increases the risk of tendon rupture. For a list of all these antibiotics that could put you at risk, look for this story in our health section at local10.com.